that much. But I guess I'll introduce myself. I'm Patti Allen, and I'm the board. I'm Heart for Squirrels. And I guess it started for me pretty much like it did for all of you, by finding that first little baby squirrel, and then your life just kind of went off the deep end. You just never came back to normal again, whatever normal is. So it was in 2011 when I found my first baby squirrel. And unfortunately, I didn't have enough information to be able to save my baby. And it so devastated me that I just continued to dig and dig and dig and dig and learn, from my mistakes to see what could have been done differently. It was very obvious what I could have done different, but then it was not obvious. And I found a squirrel forum, and then the interest just grew and grew and grew from there. And I think that's the way it happened for all of us. And Judy had asked me probably 8 months ago if I would speak today on antibiotics, and I agreed. That's basically my background for what I do in my job. I have a bachelor's degree in biology and a master's degree in microbiology, and I've been working as a clinical microbiologist for 37 years.
Wow.
And for the last 22 years, I've been at Moffitt Cancer Center. Some of y'all might know Moffitt Cancer Center in Tampa. So I've been there for 22 years, and I'm very hopeful that in 18 months I can retire. So, and then, I can do the things that make me happy and that I enjoy. I mean, my job is a wonderful, great job, but you know what? There are other things in life besides working, and that's what I want to pursue. So I'll go ahead and I'm going to talk today on antibiotic selection and dosing. And I'm going to give you a little introduction into Microbiology 101. And I just feel like it's going to be very, very brief, because I realize that that's not a subject that will interest most people, but I feel like we kind of need to scratch the surface just a little bit to give you an understanding of the organisms that you're treating. So I'm going to just briefly touch on that. So first, I'd like to introduce you to Hammy. And Hammy is a squirrel that some of y'all might know back from 2012. And again, I had not been on, a squirrel forum for that long at that time, so I wasn't very active as far as participating and giving my opinion or whatever. And no one knew my background, that I, had knowledge of antibiotics and infections and things like that. And, you just have to sometimes ease your way in and not just jump in there and go, oh, I know what to do. You just have to do that carefully. So I didn't say anything. So Hammy was a little fox squirrel up in Indiana that had been found just barely above a pinky, maybe a couple weeks old. And he was like the typical train wreck. He had a broken arm, he had puncture wounds all over him. I mean, he was just a wreck. He was one of those that was probably not likely to survive, but he did survive. And his mother, the lady that raised him, did a great job. And she had a vet that was helping her, but he was a cat and dog vet. And he admitted, I don't know anything about wildlife, but I'll help you out. So I always respected that, still do, because most vets won't help you. They'll just tell you. You say wildlife, they just that big wall goes up, they go crazy. So anyway, this guy was helping her, with antibiotics and things. But he, admitted, he says, I don't know a lot about wildlife. So anyway, it seemed that Hammy had gotten better. He was thriving, and his wounds healed, and his arm mended, and things seemed to be going well. Well, in the meantime, his mom had found a squirrel forum, and she's telling about Hammy. And then all of a sudden, he developed like a lump on his elbow. And she was pretty concerned about that. Well, within a short time, this ruptured, and it was an abscess. So, that was the beginning of a series of abscesses. And of course, the vet was treating him with Baytril, which is a fluoroquinolone drug, and they continued to treat him with Baytril, and he continued to get worse and worse and worse. He was getting his axillary area under his arm was just massive wound and infection, and other abscesses were coming out. So they added Septra, which is SMZ, trimethoprim sulfa. They added that, got a little bit better, but then it kind of regressed again. Eventually, they ultimately did an X-ray and noticed that the infection was in the bone now. Well, bone infections are very, very hard to treat. So they used a drug that's typically used for bone infections, which was doxycycline. But at this point, you know, we were kind of heading in a bad direction with Hammy. And, you know, there's just some people on these forums that you feel like you know the person themselves through their words. And, you know, I got really, really attached to Hammy. And as you would suspect, it just continued to deteriorate. And one day, you know, she's posting, she says he can't breathe, and then she says he's gone. And I cried. And it was the first squirrel that I ever cried over that I never even knew. But I was so touched by this little animal, he made me cry. And as a matter of fact, I recently went back and read his thread to familiarize myself with him again. It's been 4 years ago, and I cried again. And I thought, my goodness, you know, get a grip here. But anyway, I was so touched by Hammy that it was at that point I said to myself, I said, you know what, if I can make a difference, I will. I will speak up. If I feel like there's another drug that I think is better, I'm going to say it. So, you know, I look back in retrospect now, and I know that there are other drugs that would have worked better. I know they would have. I don't have any doubt in my mind. So that's the reason that I'm here today. I mean, I don't know it all. None of us know it all. We're all a work in progress. We're all learning every day. But I felt like through Hammy was a way to combine what I love doing with squirrels with what I do as a profession through my job. So that's why I'm here today. So that's why I'm going to give this talk today. So that's Hammy, the guy that really touched me. And our objectives today is just a little bit of basic microbiology. We're not going to get real deep in it because I realize that'll, you know, have y'all ever seen the video online of the meerkats? The one, I think the one I like the most is when the preacher starts to preach. You know, the meerkat's sitting there like this, and then all of a sudden, you know, he falls forward, and his tail hits him in the nose, you know, he's like this, you know. Well, if I see any of that out there, I'll know I need to speed it up a little bit. So anyway, and also we're going to talk about selecting the appropriate antibiotic. And at the very end, we're going to talk about calculating the proper dose. And I know that some of y'all do know how to do that. I know that there are others that would like to learn how to do that. And I'm going to show you 2 ways to do it. And I truly believe that I can teach anybody how to dose. The first 2 times that someone tried to teach me, it was like they were using an indirect approach. They were like kind of going around the block to get to something that to me was very good. Now that I get it, it's pretty simple. It's really not that difficult, but it was just like the approach of teaching it. It just wasn't sinking in for me. But now that I've got it, honey, I got it. You know, I get it, and I believe I can teach you to get it too. And you know what? If you don't get it, I even have an easier way. I have an app for that. So I'll show you the app. So all you got to do is plug in the numbers. So I believe that anybody can do it. So we'll go ahead and start. And again, I'm not a great public speaker by any means, so you know, I'll be chugging the water here to keep my mouth wet. Okay, so we will start. Okay, so let's talk about bacteria. You know, obviously, this is what we're going to be treating, bacteria. So, you know, when antibiotic error came into being, it was probably the greatest thing that affected medicine in the history of mankind. You know, because earlier, you know, before antibiotics, that was the #1 killer, was infections. So, I mean, you know, you were talking life expectancies of 40 years old, you know, and now we have life expectancies, you know, pushing 80. So, by being able to cure these infections with antibiotics, it's just changed the history of the whole world. And it's obviously changed, well, you know, we're obviously in the antibiotic era. It's not like we were living 60 years ago, but it affects animals also. So let's talk about these bacteria, the different classifications. First, you know, I hear people on squirrel forums talk about gram-negative and gram-positive organisms, and I kind of wonder, okay, I bet you a few people know what that is, but I bet you most people don't even know what that means. So I'm going to teach you and tell you what that means. It's basically a stain. It's kind of the basis of all microbiology. This individual, obviously everybody names everything after themselves, Hans Christian Graham, he developed a stain that could differentiate bacteria into gram-negative or gram-positive. So basically, if at the end of the stain, if the organism is red, it's a gram-negative organism. If it's blue, kind of a navy blue, it's a gram-positive organism. And you wonder, well, why do I need to know that? That's very important when you start picking your antibiotic, okay? Because you'll pick your antibiotic based on that. You know, obviously I work in people medicine, and you know that there's a really life-threatening thing that people get is sepsis. You know, animals, when they get sepsis, you know, they're going to crash pretty quick. Because when you get septic, that means bacteria in your blood, you can be dead in a very short time. So they do blood cultures on people, and when that blood culture comes up positive, we will call the physician immediately and we'll tell him it's a gram-positive organism or it's a gram-negative organism, and that will direct his treatment. He will pick his treatment based on that information. So gram-negative, and then I'll show you a little more here. This is just briefly how the stain works. There's just a 4-step stage. It takes about less than 5 minutes to do it. Crystal violet, or gentian violet, some people call it, the first step. Okay, then you wash that off and you add iodine. Wash that off, you decolorize with acid alcohol, and then the 4th step is a saffron. Okay, at the beginning everything stains purple. Everything. Then the iodine is a mordant, it seals it. And then the decolorization, your gram-positive organisms hold that stain, and they stay blue. But your gram-negatives lose the color, the stain. So on your counter stain, they take up the red stain, and these stay blue. And it's all based on the cell wall. You'll notice here on this side is a gram-positive organism, on this side is a gram-negative organism. And you see this little green layer here? That's what they call a peptidoglycan layer. It's very, very thin. So that's why this stain washes away. Just when you put the decolorizer, boom, it washes away. Then it has no stain. This right here, the gram-positive, is very, very thick, so it holds that stain, so it's going to stay blue. Well, again, why is that important? Because you're going to pick an antibiotic based on that. Okay, we also know that bacteria have different shapes. There's a round shape, which is a cocci or coccus, a rod shape, which is bacillus. There's also a spiral shape, spirochete, which we won't really talk about today. An example of that, see, I knew I was going to do this because this has the, okay.
This has the uh-oh button.
Yeah, it has the pointer right next to the forward and reverse. I brought this, I probably should use this for my pointer. Because I'm not really coordinated enough to do both on the same thing. So, but anyway, this is a spirochete, and an example of that you might have heard of is like Campylobacter. It's a GI infection that people get, usually from your pets or chickens or things like that. But it's a spiral-shaped organism. We're really not going to talk about that. Your cocci, your round organisms, can be arranged in pairs, diplococci, or in chains. Streptococcus, you've probably all heard of streptococcus. Okay, that's those cocci lined up in a chain. And then staphylococcus, which is your cocci that are arranged in clusters. Okay, and this is some examples of what some gram stains under the microscope actually look like. So this one is red, so what would that be? Gram-negative, and it's shaped like a bacillus, so it's a gram-negative rod. And this right here is a white blood cell. These right here, so this would be like, say, E. coli, Salmonella, Shigella, things like that are gram-negative rods. Over here, this is a gram-positive rod. That would be like Listeria, Clostridium tetani, Clostridium botulinum. Also, some of you have probably heard of C. diff infections. Okay, a C. diff infection would look like this. Okay, and here's your strep. And these are actually under the microscope, so this is what it looks like under the microscope. And this is strep. You can see your cocci in chains. This one is cocci in pairs and short chains. And these are deteriorating white blood cells. This actually is Streptococcus pneumonia. And the reason you know that is you see a little halo around the organism. That's a capsule, and that capsule kind of resists the staining. You know, it doesn't stain. So you see that little halo around the organism. It actually, when an organism has a capsule around it, it's much more virulent and harder to treat. So that's important. Okay, and here's your staph. This is gram-positive cocci in clusters, and here it is in the clinical specimen. Okay, so we're going to classify our antibiotics based on 3 things. One is the spectrum of activity, the effect that it has on the bacteria, and also the mode of action. This is probably the longest section, but I probably will move through it a little faster. I'm going to hit the highlights because I don't want to bog you down in information that's kind of TMI, which you may not be interested in. But the first one, the spectrum of activity, is something that you're all pretty familiar with. A broad spectrum versus a narrow spectrum antibiotic. And you see my little picture here. Examples of some broad spectrum antibiotics are your carbapenems. We're never going to be using those. Vets might. Those are, quote, the last line of therapy for human medicine, so we're unlikely to be using those. They're also very expensive. Chloramphenicol. Okay, here's something I want everybody to catch. I want you to see this really, really clear because this is one of my pet peeves right here. On your broad spectrum antibiotics, you'll see third generation fluoroquinolones. Cipro and Baytril are second generation. Do you see second generation here as a broad spectrum? No, it is not. It used to be. You see, your quinolone drugs, your fluoroquinolone drugs, have developed resistance so fast that what used to apply 20 years ago when they were introduced no longer applies. So vets love Baytril. They love it. They use it for everything. It's lost its punch. It's not what it used to be. So, you have to kind of stay up with the times and know that you can't use Baytril to treat everything. So, and you see it right here on this thing. Yeah, there are third generation or fourth generation, fifth generation fluoroquinolones that are good. They're very broad spectrum. They'll cover gram-negative organisms, gram-positive organisms, but not your first and second generation fluoroquinolones. Okay? Also broad spectrum are your second, third, and fourth generation cephalosporins. Notice again, your first generation is not broad spectrum, and that would be like your Keflex, your cephalexin, narrow spectrum. So always keep in mind, the spectrum of activity, whether it's broad, whether it'll cover a lot of organisms, or whether it's narrow, targeting a specific organism. And then, of course, your tetracycline class, like your doxycycline. Your narrow spectrum would be penicillin. To be honest with you, penicillin as itself, the old drug that we know, penicillin, has a spectrum of activity about this big. It is very, very specific. It treats strep and a few other things. It has no activity against staph at all. As a matter of fact, when penicillin was first introduced in the mid-40s, during the mid-height of World War II, penicillin was the bomb. It was the miracle drug. Because you know what? All those soldiers were dying on the battlefield from wounds because there were no antibiotics to treat them. I mean, they were using the sulfa drugs. They were sulfa drugs, but they weren't that effective either against these massive wounds. So when they introduced penicillin, it was just like it changed the whole course of everything because it was so good. Back then, virtually all staff were sensitive to penicillin. And you know what? Let's face it, wounds are usually caused by staph infections. So you could cure these infections with penicillin. Now does anybody, I'm sure somebody can probably tell me, do you know what they used before they had penicillin to treat these battle wounds? Amputation. I mean, to me that's not a very good treatment. But if that's what you needed to save your life, clearly, you'd rather lose a limb than your life. So when they introduced penicillin, it was the bomb. It changed the course of everything. These soldiers began to live. Okay, I started in microbiology. Now keep in mind that was in the mid-40s, like 1945. I wasn't born then, but okay, close. When I started in microbiology in 1979, things had changed a lot. 90% of staff were resistant to penicillin. 90%. In that 30-year period. Now, today, fast forward to 37 years of my career, almost virtually 100% of staff are resistant to penicillin. You might find a rare one. And we get to where I work, it's a medical, they linked up with a medical school there. So we actually, part of my job is teaching ID fellows. Well, ID fellows are people that have gone through medical school. They finish their residency in internal medicine or pediatrics, and then beyond that they're doing a 2-year fellowship in infectious diseases, which is basically treating infections. So we get to, at the end of their rotation, we get to sit with them for like a month, and they basically sit on the bench and they learn what we do from our side. So I pick their brains. They all know about squirrels, let me tell you, and about treating infections. So, but they share interesting little tidbits with me. And see, I love teaching them, and it's that interaction thing. And one of the things that they told me that I found very, very interesting, of course, the VA hospital is almost virtually across the street from Moffitt. So, they do their rotation at different hospitals. And they told me, they said that every now and then they will see one of these old veterans, that has some shrapnel in his leg from 60 years ago. And he will come into the hospital, and now all of a sudden it's been sitting there dormant for 50 or 60 years, not causing him any problem, and now all of a sudden this thing reactivates. His immune system is shot. He's 80 years old, he's 70, his immune system shot. And now you get reactivation of this infection, and guess what? It's penicillin sensitive because it was an organism's been sitting there smoldering for all those years. So I find little tidbits like that to be kind of interesting. Okay, also another one that I love is becoming one of my favorite drugs, the lincosamides, which is our clindamycin. I love clindamycin. That's an excellent drug. These others we're probably not going to talk about. This glycopeptide is vancomycin. Again, that's another one that is last line of therapy for human infections. So it has very few veterinary applications, so we really won't be talking a lot about it. But it's basically the one they pick when you've got an MRSA or infectious or something like that. It's pretty serious and they can't treat with anything else. They usually use vancomycin. Keep in mind that's a narrow spectrum drug, so they need to know what they're treating. Okay, the effect on the bacteria. It can either be bacteriostatic or bactericidal. Okay, and the root of the word bactericidal, like homicide or suicide, that means death. Okay, so you can either kill the bacteria or you can suppress it, okay, or prevent it from replicating. And you see these little bacteria here, they look like they're pretty dead, don't they? The little eyes crossed out. And these right here, they're just kind of tied up. So there's some examples: chloroerythroclinda, sulfonamides, trimethoprim, tetracycline, or bacteriostatic, and some examples of your bactericidal. When you see the word beta-lactam, that's your penicillin drugs. Now, we're not talking about penicillin itself. Penicillin has come many, many, many generations from where it first started. As a matter of fact, our clavamox is a penicillin class drug. And that, when you see the word beta-lactam, that's referring to a penicillin type drug. Your quinolones, bactericidal, metronidazole, bactericidal. I will make a note here. Sulfonamides by themselves, or trimethoprim by itself, is bacteriostatic, but what they do is they link those two together, as in Septra or Bactrim, trimethoprim, sulfa. Then it becomes, when you link these two together, then they become bactericidal. Okay, the mode of action. How do antibiotics work? Okay, I'll tell you briefly, because like I said, I don't want to get too deep on this. I found myself this little bacteria here, and I thought, wow, a model, And I don't know, I believe if you're going to teach something, if you use a model or something, I believe you can kind of get it a little better. But this is a bacteria here. This is a rod. We'll call it a gram-negative rod. It's green, but we'll call it a gram-negative rod. This is a flagella. Some of them are motile, some of them are not. This one happens to be motile because it has a flagella, so it can move and swim. Okay, and basically what's up here, I'll demonstrate with this little guy here. Okay, his tail falls out immediately, which is fine because we don't need that. I just want you to see how really simple a bacteria really is. Human mammal cells, squirrel cells, are pretty complex cells, but a bacteria cell is really, really simple. So there's not really a lot of things you can do to kill it. So you basically have to exploit what's there, okay? It has a cell wall, okay? Mammal cells don't have cell walls, okay? So that's important. So in other words, you can attack the cell wall of this bacteria without attacking your own cells, because you don't want to kill the host also. I mean, we want to kill the bacteria selectively, and we don't want to injure the squirrel, okay? Bacteria also has inside a cell membrane. which is a lot thinner, obviously. And keep in mind that these layers are permeable that allow exchange of fluid in and out. Okay, and inside here is the DNA. And the DNA basically is the genetic blueprint, it's the chromosomes, if you will. So bacteria basically they don't even have a nucleus inside. You know, our cells have a nucleus inside. These don't. They just have everything floating around in the inside of this thing. And one other thing, and this is kind of important here, these little green dots in here are called ribosomes. And ribosomes actually make protein. Okay, that's important because most of this bacteria is protein. So you have to be able to make protein to survive. Okay, this briefly, and again, you have this in your handouts, and I apologize for them being so small. This was the first PowerPoint presentation I ever did, and you know, you learn lessons, and the lesson that I learned that if you create it in landscape, when you want to make your handout, you can't convert it to portrait because it messes up the slides. So unfortunately, they're a little bit small, but I hope you can, you know, maybe with your magnifying. So that was one of my learning lessons there about making a PowerPoint. Okay, and this, just briefly, and we'll talk a little more about this. It shows the, you better watch that or I'll be turning the slide again. Some of the antibiotics actually will affect the cell wall, your penicillin drugs, okay, your vancomycin. Some of them will affect the DNA, your quinolones like Beta-fluorocypro, nitroimidazole, which is your metronidazole, and the ones that affect these ribosomes, which are your protein, that make protein, are tetracyclines, aminoglycosides, this amikacin, gentamicin, tobramycin, your clindamycin, macrolide, which is erythromycin, and azithromycin, others, and then your chloramphenicol. But we'll talk about those more in detail. There's only 5 basic mechanisms that you can kill a bacteria with. There's not a million, there's only 5. You either have to inhibit the cell wall, you have to attack it here on the cell wall, or you have to attack it on the cell membrane, or you have to inhibit its ability to make protein, okay? Or you can inhibit the nucleic acid, which is your DNA. If you can inhibit that, you can inhibit the organism, you can kill the organism, okay? And then the last one is to inhibit a metabolic process that's unique to bacteria. So we'll talk briefly about those and give you some examples. And like I said, I don't want to get real deep in this, but I don't want to just lose you in TMI land. So, okay, those antibiotics that affect the cell wall, this bacteria, is actually the most common method that antibiotics use to kill bacteria. And as I mentioned, animals and humans, we don't have cell walls, so it's not going to affect our cells. The wall is critical for survival of the bacteria. A drug that targets the cell wall will either kill or inhibit the bacteria, and it leads to death by osmotic instability. And I brought this little guy just to show you an example here. This would be a gram-negative rod. Some bacteria actually do have flagella all over them. They're peritrichous, and they have flagella all over. But the reason I like this little guy is because he's a soft, squishy little thing. So basically what happens to that cell wall, if you've interrupted the ability of the organism to produce the cell wall, it will weaken. So when it kind of makes this little balloon here, it will rupture, the cell will rupture, and you've killed it. So that's why I brought you. Okay, so, and some examples of the ones that attack the cell wall are your penicillin class drugs. By the way, I'm going to go ahead and take the time to say this because, you know, some people may not know this, and it was funny because Penny was telling me last night that about someone that had used penicillin. Penicillin G is the old injectable penicillin. That's the kind that when I was a kid, that's what they always gave everybody. You know, everybody's going to get a penicillin shot. If you went to the doctor, you're going to get a penicillin shot. I don't know how many people have ever had penicillin shots. They hurt. They hurt like a bear. That's why they give them to you in the rump, because you got more meat back there, and they hurt. So what they did with penicillin is they incorporated procaine, which is an anesthetic. The other name for procaine is Novocaine. Now we all know Novocaine because that's what they used to use in dentistry to deaden your teeth. Now they use lidocaine, which I believe obviously has advantages. But this procaine is in that class of drugs. Well, think of procaine, novocaine, lidocaine, cocaine. They're all in the same class. And that drug, the penicillin is totally safe. It has no effect whatever on a squirrel or a human. That procaine is deadly to rodents. It will kill rodents. So you never want to give injectable penicillin to a squirrel because it will kill them. It affects the central nervous system, so you don't want to be doing that. And it's a very readily available drug because you can get it at Tractor Supply or any of those places like that. And I've seen people say, well, I can get some penicillin. Don't do it. Don't do it. Okay. Cephalosporins. Believe it or not, the cephalosporins are also in the penicillin class. Okay. Spectrum of activity, broad spectrum. Second, third, and fourth generation cephalosporins, narrow, obviously your penicillin, and they're bactericidal. Okay. And this other one, this is, I already mentioned, this is your vancomycin. Very limited use in veterinary medicine, but it also affects the cell wall. Okay. Those that inhibit the cell membrane function, this inside here. Okay. And you can see that they affect the organism by increasing the cell permeability, like a detergent. You know how detergent works? Okay, that's how these drugs work, is by increasing the permeability. And when that happens, fluids can flow in or out, and again, the cell is going to die or rupture, or maybe it might even just shrivel up. Okay, some examples of that are polymyxin B and E. And another name for polymyxin E is colistin. And this class of drugs are very, very toxic. And usually, these are incorporated into topical antibiotics. I'm sure you've all heard of polymyxin B ointment for your triple antibiotic ointment. They have polymyxin B in them. And the reason is because they're so toxic, is why they're not usually given orally. Okay, the colistin actually is being used some now in life-threatening cases for people, because if you've got an infection that can't be treated with anything else, you're going to pull something else out of the toolbox, even if it's toxic. I mean, you may shut down the kidneys, but you'll cure the infection. So sometimes it's risk versus benefit. But every antibiotic that you put in your body, or any pill, is risk versus benefit. If the benefit exceeds the risk, you do it. Okay. Okay, and then this is a large class, and like I say, we'll move through this fast. Those that inhibit the protein synthesis. And why is that important? Okay, well, this bacteria is 70% water. Okay, of the part, if you remove, just like us, we're mostly water too. If you dry us down, there's not much left, right? Okay, so that 30%, this chemical or structural components, okay, half of that is protein. Okay, well, half of your structure is protein. If you shut that process down, that's not consistent with life, is it? So a lot of these antibiotics actually affect that ability to make protein. Okay. And most of that group are bacteriostatic, with some dose-dependent can be bactericidal. Another example are your aminoglycosides, tobra, gentamicin, amikacin, neomycin. Broad spectrum, but they have no activity against anaerobic bacteria, bactericidal. They're limited to severe infections because of their toxicity. And I believe they're used, I believe Penny got some, like through her port when she had her odontomy surgery. So, but then again, that's more of a topical application.
And that was next to saline.
Yes, exactly. It was diluted and mixed with saline and introduced into her port. Okay, so that's basically kind of a topical application. And the reason they're they're toxic is because they're extremely nephrotoxic. They can shut your kidneys down. But they're definitely used because they're excellent. I mean, they have a very good spectrum of activity. Okay, neomycin is in this group. It is extremely nephrotoxic. and it's frequently used in topicals. I'm sure you've all heard of neomycin ointment. It's never injected. It is way too toxic to be injected. But sometimes it's basically just for gram-negative organisms, gram-negative rods. See why it was important to know gram-negative or gram-positive? It's only for gram-negative organisms. It's not absorbed in the GI tract. So what they would do is if you had an infection in your GI tract, like say an overgrowth of gram-negative rods or whatever, maybe you had a salmonella they couldn't cure or whatever. I'm not sure why they would use it, but they would give it orally, and it would basically kind of wipe you out. It would kill your GI flora. So if for whatever reason they wanted to do that, this drug would do that. Okay, but it's never injected because it's extremely toxic. Okay, this one also is another example of protein synthesis inhibition. Is your chloramphenicol and Nuflor. The Nuflor is a veterinary antibiotic. It is a broad spectrum antibiotic. It's an excellent antibiotic. I am probably never going to be using chloramphenicol. It's not used in this country anymore for people. And the reason it's not used is because it suppresses the bone marrow. And in some people it causes aplastic anemia, which can be fatal. Well, that's very rare, but if it's you, it made all the difference in the world. And in this country we have way too many lawyers for that to be happening. So it actually is being used in other developing countries like South America. They use a boatload of chloramphenicol. It's cheap, it's readily available, and it's highly effective. It'll kill gram-negatives, gram-positives, also anaerobic organisms. They always tell you to handle it with gloves. I get a little nervous when they tell me to start handling stuff with gloves. If it's that toxic, I'm like, do I really want to be giving this to something? The veterinary formula, and I know that Karen uses a lot of Nuflor. It is kind of a reworking of the same drug. It's an injectable, but I do believe that they do give it orally, but I believe it's safer. It doesn't carry that risk of aplastic anemia, but it is an excellent drug. But the thing with that is, I'm never going to be able to get that unless I go through a vet. You're not going to be able to buy that without a prescription. Okay, another example would be your tetracycline class, or which includes your doxycycline. Broad spectrum, it also includes your atypical organisms, things like Lyme's disease, typhus. I don't know if y'all know this, but flying squirrels, I love my flying squirrels. I have 3 of them. Flying squirrels are the only known reservoir of typhus in this country. I think some of them carry it. So some people actually catch typhus from flying squirrels. So, and again, that will be treated with doxycycline. It's funny, one of the ID fellows that sat with me, like I say, I'm always teaching them about squirrels, and they says, well, if you ever get sick, you need to take doxycycline. I says, I'll keep that in mind. So, okay, it's a very good drug for bone infections. It actually chelates to bone and tooth enamel. And the word chelate means claw. So in other words, it clamps onto bone or tooth enamel. Okay, it's never used in little children or pregnant women, and the reason is because it will permanently turn your teeth yellow. Nobody wants yellow teeth. But see, I wrote there, I don't think squirrels mind. Their teeth are orange, so they don't really care. They're okay with yellow teeth because theirs are orange anyway. It's actually been found in skeletal remains that go back to, a couple thousand years. So it's been around a long time. In the environment, people are being exposed to antibiotics. Things back, like, in the history, you'll hear like healing soils or things like that. They're naturally occurring antibiotics that people were being exposed to long ago. Another one is your macrolide class, erythromycin and azithromycin, narrow spectrum, gram-positive organisms only with a few exceptions. This is an interesting class. It's because it's what they call immunomodulators. Okay, now I don't know if Sue is here. She was a respiratory therapist. But anyway, this drug is sometimes used, the azithromycin is used for non-antibiotic purposes. It's used because it will it's a strong anti-inflammatory properties, and it also reduces mucus production. So patients with like cystic fibrosis, that are like drowning on their own mucus, they will give them this for non-antibiotic purposes to exploit those immunomodulator effects. I have an interest in azithromycin. And like I said, I've been watching squirrel forums for the last 6 years to see what people use to treat things with. Because I'm not a cowboy. I'm not a person that's going to say, well, let's use this if it's never been tried and tested. I want to see that someone else used it before I said use that. And I noticed that Penny got azithromycin when she had suspected that her issue was respiratory. And of course it didn't work, because ultimately that was not the cause of her problem, but she took it quite successfully. What I want to see is someone use azithromycin to treat mycoplasma. Because mycoplasma is difficult to treat. They'll use Baytril, they'll use doxycycline. I want to see somebody use azithromycin because that has the ability to cure it. Because with these rats, I don't know if y'all know this, but all rats carry mycoplasma. All of them. As a matter of fact, they have created a strain of mycoplasma-free rats. And I'm not even going to tell you how they created it, because it just horrifies me, the way they were able to create this strain. Because sometimes in research, they need animals for research that don't have these situations that they all have. So they have created a strain of mycoplasma-free mice. Like I say, it just horrifies me to think about it. But anyway, they all have it. All rats have it. That's why they only live 2 years. A long time life expectancy for a rat, maybe 3 years. They'll all die by the time they're 2 years old. They're old at 2. So, but see, I don't think squirrels carry mycoplasma to that degree because they live 15 years. So I don't think squirrels are carrying mycoplasma to the degree that rats do, even though they're rodents. But I do think that they can get it. Clearly, I think they can get it, and I want to see someone use azithromycin in curing. That's what I want to see. Haven't seen that yet, but I'd like to see that. Okay, another one, inhibition of protein synthesis, is your clindamycin, moderate spectrum. The reason they call it moderate spectrum, it only affects gram-positive organisms, but it is the bomb for anaerobic infections. The bomb. I haven't really said, an anaerobic infection, there are aerobic organisms and there are anaerobic organisms. An aerobic organism are those that grow in the presence of air. Staph aureus, E. coli, Pseudomonas. Anaerobic organisms are those that grow without oxygen. Strict anaerobes, things like Clostridium tetani, Clostridium perfringens, those are strict anaerobes. And you see those are associated with deep penetrating wounds. It's because you don't find Clostridium growing on the skin, because it has to grow without air. And if it's on the skin, it's going to have exposure to air and it will die. So that's why they say, when you step on that rusty nail and get this puncture wound that goes deep, you've created an anaerobic environment where that organism can thrive. So that's the difference between aerobic and an anaerobic organism. Okay, so clindamycin is primarily for gram-positive organisms and anaerobes. Depending on the dose, it can be bactericidal. Excellent. Another thing about it that I love is it penetrates bone. It is the bomb. There's only a few, and we'll talk more about specific sources, but it is the bomb for treating bone infections. It actually is my favorite drug for treating staph infections. Okay, all right. I want to address this. This bothers me. The Wild Mammal Baby book, which we all love, is an excellent book. It is an excellent book, and I bought the new edition, the 3rd edition. It says, as a note at the bottom, it says, do not use for rodents and beavers and ruminants and things like this. And because of that, for the longest time, nobody would touch it. Just don't use that. The Wild Mammal book, baby book said don't use it. You can't use that. I truly believe that if Hammy had been given clindamycin, he would have lived. But because we were afraid to use it, we wouldn't touch it. And I certainly wasn't going to recommend it. I mean, who am I to say? You know, I mean, I know people medicine. I don't know about rodents. You know, what's the problem? Why can't a rodent take that? So then I began to study that. And then there were a few people that came out and says, well, United Kingdom says, well, we use that for rodents. We've used that for our squirrels. And then another person said, well, my vet used that. I'm thinking, okay, what's the story here? Come to find out, it's because rodents are diverse. The reason an animal is put into the rodent class is because of those two big teeth, those incisors that continue to grow. That's why they're in the rodent class, because of those teeth. Okay. Rabbits have been, obviously their teeth grow, but they've been removed, and they're in a group called the lagomorphs. Okay, but all the others, hamsters, guinea pigs, squirrels, rats, anything like that that has to keep their teeth filed down is put in the rodent class. Okay, but the thing is, they're very different. They're not all the same. They're very, very diverse. The animals like, let's see, guinea pigs and hamsters, and rabbits too, but they're not rodents anymore. They're hay eaters. They eat hay. Their diet is hay, okay? Squirrels are not hay or grass eaters. They're different, you know? And the problem is, depending on your type of digestion, it can be a deadly antibiotic. For animals like those hay eaters, guinea pigs, hamsters, rabbits, chinchilla, it can be deadly to give a narrow spectrum. See, this clindamycin is a narrow spectrum antibiotic. If you give a narrow spectrum antibiotic, you will kill that animal. And the reason is because they're what they call hind gut fermenters. Okay, they have this big digestion. You know, they got to break down all that cellulose. You know, because we can't break down cellulose. I mean, we chew it and we cook it, and but there's a lot of roughage in plant material. Well, these animals that's their primary diet, they need to be able to break that down. So they're called hind gut fermenters. Okay, and they have bacteria in their gut that helps them to break down that plant material. Okay, so if it's that important, that digestion process, okay, what happens if you start creating an imbalance in that digestion? Let's say like this, your flora, gram-negative, gram-positive, anaerobic, everything is in balance, okay? Everything is good. What happens in one of these animals where the balance is critical if you give a narrow spectrum antibiotic like clindamycin? All of a sudden now, you're beginning to suppress your gram-positive organisms. You've created what they call a dysbiosis, D-Y-S-B-I-O-S-I-S. That is an imbalance of your GI flora. So now what happens is these gram-negative organisms begin to grow. They begin to produce toxins, and they also are real big gas producers. So what happens? That animal will bloat, and he will die because of dysbiosis. Squirrels aren't that way. Neither are rats. They can take it fine. That balance is not that critical. Just like us, we can take narrow spectrum antibiotics. We don't die from it. I mean, yeah, it might upset your stomach. You'll take some probiotics.
Is that the sulfa drug?
Which one? Clindamycin? No.
It does not have sulfa?
No, not at all. Not at all. So the bottom line, the take-home message, squirrels can take clindamycin, and it is the bomb. It is the bomb. I love it for treating wound infections. Okay, so if I've thoroughly dispelled that myth that squirrels can't take clindamycin, they most certainly can. Oh, and I'll give even one step further. There was a vet here last year, not Dr. Emerson, but there was another vet here that has a non-release squirrel that had a bone infection in her teeth. She had her squirrel on clindamycin for 8 weeks to clear up that bone infection, and it worked. 8 weeks. So even long-term treatment is okay. On the squirrel board, Gail has Peggy. Peggy had a bone infection. She took clindamycin. It cured up her bone infection. So it is a good antibiotic. So just ignore that in the Wild Mammal Baby book. I think they should have clarified it. I really wanted to see the new edition clarify that and make a statement that made you understand why they had that there. But I think it was a little too broad. It this bothers me, there are still rehabbers today They will not use clindamycin because of that statement. And they're missing a great drug. Great drug. Okay, this is the group that inhibits the DNA. It's everybody's favorite drug, the fluoroquinolones. Broad spectrum, if it's the 3rd generation or above, narrow spectrum, 1st generation. You can see that what we use is 2nd generation. It covers primarily gram-negative organisms. Keep this in mind, almost all MRSA are resistant to the fluoroquinolone drugs, almost all of them. Okay, so, and it's been reduced spectrum due to resistance.
Can
Okay.
I bring something up real quick?
Sure.
I had to take Cipro once for a really bad respiratory. I had a major reaction.
Right.
So I presented, well, some of these squirrels are not reacting to the Baytril or the Cipro. They go in like a different direction.
Right. Well, there's anytime. Right. Well, there's always a risk of an allergic reaction or some kind of reaction. That's always going to be the case with any specific individual with any drug. There's always, that's going to be a potential possibility. And I'll go ahead and tell you this while you brought that up. Septra. That's one of the reasons I'm a little less excited about Septra. Septra is very hard to take. Sulfa drugs, a lot of people have reactions. So I would assume that squirrels probably have reactions to Septra too, although it is a good drug. You're more likely to have a reaction with sulfa drug.
You have to be aware and look for that.
Right, oh, absolutely. You know, any drug, you know, when you start giving a drug, you always need to be looking out for possible side effects. Okay, I'm going to go ahead and state this, and I'll go ahead and tell you now that vets disagree with me. They don't agree with me. But I'm going to say, in my professional opinion, those two should not be used to treat wounds due to their limited coverage of staph, strep, and anaerobes. Okay, do you know what most wounds are caused by? Staph, strep, or anaerobes. So it only seems reasonable to me, why would you use that drug when it has less likelihood of being one that will be effective? So I will never use that drug for treating wounds. Now, it can be used as part of a combo. See, it's strictly for or not strictly, but primarily for gram-negative organisms. Now, are there some organisms that will be treated, like say a staph, that could be sensitive to Cipro? Absolutely there is, definitely. But the thing is, the balance is tipping, you know, against its effectiveness for that particular drug and a combo with the staph. So it's kind of like going to the dog track and betting on a loser. You know, something that has the potential of not winning. You know, I want to put my money on the one that has the best chance of winning. And that's the way I'm going to pick an antibiotic too. The one that has the best possibility of treating that infection, that's the one I'm going to pick. And I can tell you right now, for a wound, it's not Cipro and it's not Baytril. Okay. So, again, there's always exceptions. If it's a penetrating wound in your GI, you got a lot of gram-negative flora in your gut. E. coli. Anything that has fecal contamination, sure, add Cipro in there because, you know, it's a mixed infection. It can be part of that therapy, but I don't think it should ever stand alone in a wound infection. Okay, Flagyl, metronidazole, antibiotic and anti-protozoal activity. So when you think of this, think of treating an anaerobic infection or Giardia. It's strictly for, as far as the bacterial side, it's strictly for anaerobes. It has no activity against aerobes at all, so you would never use it alone to treat an infection. Now, you could use it alone to treat Giardia, but not an infection. Okay, the way doctors do this in people, because most of the organisms in our head are gram-positive organisms. That's a broad generalization, but for the most part, we've got gram-positive organisms in our head. Our GI diaphragm down is a lot of gram-negative organisms. The way physicians use that a lot is if the infection is suspected to be an anaerobic infection, if it's above the diaphragm, they'll use clindamycin. If it's below the diaphragm, they'll use metronidazole. Now there are some exceptions. Metronidazole almost has no resistance, almost no resistance. It'll treat anaerobes. Clindamycin is developing resistance for anaerobic organism. So, it's losing a little bit of the punch. If you go to the hospital or whatever, say with a tooth infection, they're probably going to give you clindamycin. Okay, so I will note there a little caveat at the very end. It is classed as a possible carcinogen. That always makes me a little nervous. It's shown to be carcinogenic in rats. It's been banned in the EU and the US for veterinary use in any food animal, cows, chickens, whatever. The link is not proven in people. They still use it. Clearly if it was a carcinogen, they would not use it. We'll make one note also about the metronidazole. I believe Penny also had metronidazole, and you ask, okay, well, why not clindamycin as opposed to metronidazole? And there's a reason for that also, because her odontoma, had some infection there, and that's very close to the brain. So keep in mind that clindamycin will not penetrate the brain. Metronidazole will. So that would be your justification for using that drug over the other. Okay. All right. This is your last class here. I'm sure you're probably glad at this point, but because I want to get into some more practical stuff. Okay, what do we use? But this is just the basics. Metabolic processes. These interfere with the organism's ability to make folic acid. Okay, we don't make our own folic acid. We take it in our diet. Bacteria don't. They have to make their own. If you can somehow interfere with that ability to make that compound, then you will shut down the organism. Okay, broad spectrum, and it's mostly your sulfa drugs, broad spectrum, and I believe we've already talked about some of this other stuff. It's the drug of choice. Trimethoprim sulfamethoxazole, Septra, is the drug of choice for uncomplicated MRSA infections. Unfortunately, and see that's what Hammy was on, but unfortunately, he didn't have an uncomplicated case. He had a raging case of MRSA. Okay, now to the practical stuff. Okay, you say, well, you just spent 30 minutes of my life here telling me all this stuff about the background of bacteria, etc., and how antibiotics work. Tell me what to use. Okay, that's where I want to know. What do I use? Okay, well, we realize that we're seldom going to have a definitive diagnosis. We're not going to have cultures. Occasionally, some people, like Judy had a culture done. She knew what she was treating because it was a culture, proven infection. But most of the time, we're not going to have cultures on squirrels. The few that I've actually seen usually yield no information, because usually by the time they get to the culture place, the animal has just got a raging infection. They're on massive numbers of antibiotics. And if you're on antibiotics and you take a culture, it will affect the culture. The culture will not grow because of these antibiotics. Doesn't mean the infection is gone. It just meant that you suppressed its growth on artificial media. So usually they don't yield a lot of information anyway. So the common approach is to use, if you don't know what you're treating, is to use a broad spectrum antibiotic. You don't want to use a little narrow spectrum antibiotic if you don't know what you're treating. So typically you want to use something broad spectrum. Also, the condition of the patient has to be considered. If it's an immunocompromised patient, a weak, little scrawny person, or squirrel, really debilitated, probably a bactericidal drug would be your best choice. You want to kill that organism. You don't want to suppress it, because that animal may not have time for you to suppress that infection. They need you to kill it now. Okay, so you might want to choose a bactericidal drug. Also, the location must be considered. And I think, we're going to pass this. Well, I think we've talked sufficiently about that. The location of the infection. And that's how I usually like to pick the antibiotic based on where it's located. Okay. In squirrels, we see a lot of these infections around the head. I guess it's because they're eating wood, bark, and sticks, and things like that. I guess they're in these big growing teeth. I guess they're lacerating the inside of their mouth and all that. So we see a lot of those abscesses around their face and their head and everything. So keep in mind that anywhere from your lips to the bottom of the GI tract, you have a mucous membrane. A mucous membrane has organisms. Whereas the rest of our body is sterile, with the exception of our skin. Inside your body it's sterile, except along that mucous membrane. Your GI tract, your oral, that has usual flora. So anytime you're treating an infection anywhere along that tract, you want to consider the organisms in that area as likely sources of your infection. And it's always the source of those infections when you have something around the mouth. It's going to be your mouth flora is what's causing that infection, so you want to target that. That's why your Cipro doesn't work for that, or your Baytril does not work for that. Primary organisms in your mouth are strep and anaerobes. Cipro has almost no activity against those classes of organisms, so you don't want to pick that. So that's why when they treated them with Cipro, the patient died. That's the reason. Okay, so the flora includes gram-negative, positives, anaerobes, predominant above the diaphragm, gram-positive, below gram-negative. Okay. Along those areas, the infection is likely to be polymicrobial, a lot of different organisms. It's likely to include anaerobes. Okay, and so what you would want to do is either pick a broad spectrum antibiotic or start stacking antibiotics. You want to be sure you cover the spectrum. You don't want to just pick something single. Okay. And I think people have kind of figured this out by now, because I think I probably told them enough time. A hallmark of an anaerobic infection is a foul, putrid smell. If you have a squirrel that comes in and he smells like he died 2 days ago, you probably need to consider an anaerobic infection. So there you want to use either clindamycin, well, here's some options here. Clindamycin, metronidazole, clavamox, or chloramphenicol. Those would be good ones for an anaerobic infection. I actually love clavamox. It has coverage for gram-negatives, gram-positives. It also has coverage for anaerobes. So I actually love that antibiotic. And this is the reason, the above reasons here is why you would not use it for a facial abscess, because it just doesn't cover anaerobes at all. Okay. Skin is predominantly colonized with gram-positive organisms. Staph and strep. Our skin has staph and strep on it. Squirrels do too. They have staph and strep on their skin. Okay, so you would want to treat and you would want to include coverage for staph and strep. So some good drugs would be clindamycin, Septra, or clavamox. Clavamox and Septra have a broader spectrum than clindamycin. You might miss it with clindamycin because it has that narrow spectrum, so you need to be a little more careful with that. Pyoderma, I'm sure you've all heard of pyoderma in animals, especially dogs get it, if they have these big folds of skin and all that, they get infection from skin folds. And that word, the Greek, means pus in the skin. It's usually caused by strep, but it can also be caused by staph. So you want to be able to treat for that. A pyoderma that's caused by a strep could be treated with a cephalosporin or any of those listed above. Okay, abscesses, obviously there's an association with staph aureus. Could even be MRSA. I read a paper a while back where they did a study. Of course, this is going to vary from location to location, where the wildlife, I'm trying to think what the percentage was, almost 2% of the wildlife that they captured carried MRSA. That's slightly higher than the population that people carry. Now, not in a hospital, obviously, it's going to be higher in a hospital, but for just everyday people like us, there would be a certain number of people in here that would be carrying MRSA, okay? But wildlife carry it at a slightly higher rate than we do, so you always want to be able to consider that this might be an MRSA infection. And also keep in mind that a community-acquired MRSA infection is much more aggressive than a hospital-acquired infection. So if everybody that thinks that it's all about the hospitals creating resistance, it's not. A lot of it came out of your livestock feedlots. And I kind of look at this as a broad thing. When I was young, there were like 200 million people in this country. Now there's like 330 million people, and I believe they all want to live in my community. They want to live on top of me for some reason. That just makes me crazy because I like living away from people personally. But anyway, you know, you're not going to feed 330 million people on the family farm anymore. So because of that, you got feedlots. You know, you're putting these little animals in a feedlot situation. When you start getting overpopulation in groups and masses of animals, you get disease. So what they were doing is they were treating them. They were giving these animals in livestock, chickens, they were giving all the chickens Cipro. That's where a lot of your resistance to Cipro came from, was from chicken farms, not from the hospitals. So now they actually have three categories. They have hospital-acquired MRSA, community-acquired, now they have livestock-acquired MRSA. The drug of choice, I think we already mentioned that. MRSA would be Scepter or clindamycin. And again, I'll just drive it home, MRSAs are resistant to the cephalosporins and the fluoroquinolones. Okay, we've already covered some of this. Bone infections, usually caused by Staph aureus. You always want to consider that when you have a wound that just won't heal. You know, it'll get better, look like it's well, and all of a sudden it'll come back. Gets better, comes back. You might want to consider a bone infection because that bone is really, really hard to treat. It'll keep reseeding the infection over and over. Even when they go off of antibiotics, it'll jump back up. So that's a case where you might want to consider a bone infection. And then, of course, these are your drugs for bone infections: clendodoxy, clavamoxin, chloro. So you're going to need prolonged treatment. You're not going to cure that in 7 to 10 days. You're going to be looking at a 6 weeks treatment. Actually, for people, sometimes they actually put them on treatment for the rest of their life. They'll give them doxycycline for the rest of their life if it's a situation that they can't cure it. And basically, they best manage it. So you're on doxycycline the rest of your life. I don't want one of those. I definitely don't want one of those. Okay, and as we talked about earlier, it can occur years later. Okay, urine, usually pretty easy to treat, although there are some nagging infections that just will not cure, that can get a little difficult. Cipro, Baytril, SMZ, clavamox, that's when your Cipro's good. Pull your Cipro and your Baytril out then. Those would be great. You know, that's the reason is because your GI tract is down here. You know, the plumbing is really, really close. So a lot of your UTIs are related to the GI flora. So E. coli is your #1 infection for UTIs. Okay, so that's when your Cipro would be great. Pull out your Cipro then. Okay. But then again, it's developing resistance, so even that, use caution. I think the bottom line is that if you don't see rapid improvement in a couple days, you need to think about switching and getting something else. See, that was the part that bothered me with Hammy. He'd been on Cipro for like 3 weeks, and then the vet said, we're going to keep him on it for another 4 weeks. I'm thinking, really? Stop. Use something else. Don't keep on beating that drum if it's not working. Okay. Some organisms have intrinsic resistance. We won't talk about that. Respiratory, you know, just briefly, you know, obviously the most common is aspiration pneumonia from these baby squirrels. And you know what? History has shown that Cipro works. Cipro and Baytril work. I will say this, Cipro has I say Cipro, but fluoroquinolone drugs have a very strong anti-inflammatory effect. I actually read a paper that's the fluoroquinolones have an anti-inflammatory effect equal to prednisone. I thought, wow, that's fabulous. And you know what? I believe that's why Cipro or Baytril works so fast for these squirrels, baby squirrels with pneumonia. It's because you're reducing that inflammation. You know, they can't breathe. If they can't breathe, they're not going to eat. They're going to be lethargic, and then they're going to die. But the Cipro and Baytril, it has the antibiotic effect, but it also has that anti-inflammatory effect. And I believe that once you've shrunk down those inflamed membranes, I believe they can, because, I mean, how many have ever treated them? 18 to 24 hours, it's almost like they just like turn around. I mean, it's really fast. And I don't think you kill the infection that fast, but I think that anti-inflammatory effect is what you're seeing. So you clearly have to keep giving them the antibiotic. Okay. This is it. This is the last part here that I'll call it a day here. Dosing, how do you do it? How do you break down a drug so that you can use it? It's a simple formula here. And again, like I say, if you got math anxiety and this part just blows your mind, just shut off here and I'll show you how to do it another way with an app, okay? Now all you need is three numbers. The first is you need is the animal's weight in grams. The next one you need is the dosage. The dosage, you're going to get from the Wild Mammal Baby Book. This is the new edition, the third edition. So it's actually so similar to the second edition that if you have the second edition, it's not worth buying the third. It's so close. But you're going to get it from this book. Okay, and the third you're going to need is the concentration of the drug that you have made. You're going to make the drug, so, okay. First thing, we want to weigh Rocky. And the reason I chose Rocky is because everybody names their first squirrel Rocky. Okay, so, and I did, and I thought it was unique. Come to find out, everybody had a Rocky. Okay, so you weigh him, and you want to convert it from grams to kilograms. And the way you do that is you just move your decimal place over 3 places to the left. Got some examples there. An 80-gram squirrel is 0.080 kilograms. 236 are 0.236. So all you got to do is move it over 3 places to get kilograms. So you're going to need your weight in kilograms. Okay, the next one that you're going to need is you're going to make your antibiotic solution. Okay, and I'm actually going to show you all this. I'm not going to tell you about it. I'm going to show you how to do it here. Okay, what I have here is Cipro. This is a 500 milligram pill. I did not put this in my presentation because I don't want to get a phone call.
This is Cipro?
This is Cipro. You can either get your antibiotics multiple places. You can either get it from your vet. Some people get it from family members' leftover prescriptions. There's also a place online, California Vet Supply, who sells antibiotics. They sell all of the ones that I would use with the exception of one, which is Clavamox, and they used to sell that.
Do you have to have a prescription?
No, there is absolutely no prescription required. And the reason is because they kind of,
Shady?
well, no, they're not shady at all. Let's just say that they're,
Something fell off the truck?
they're going around the law, and the way they're doing it is by selling it for fish aquariums, okay? Fish and reptiles, antibiotics, you do not need a prescription. Okay, now I'm going to stand here and I'm going to tell you the facts. This is the same drug you'd buy at Walmart. It's a people drug. It's a pharmaceutical grade drug. It's the same drug. Now obviously it's labeled Fish Flox Forte, and you've got a little fish on the thing. This is the same drug that you would take yourself. Okay?
I got all of them, and I asked my daughter who works at a pharmacy, and he said it's absolutely human grade.
It's absolutely is.
Yeah.
As a matter of fact, if you look at a pill identifier, you know, you look at that pill, it's the human drug. So California Vet Supply, although I did not put that on your handout, but that's what we wrote it down. You wrote it down, okay. And there is no prescription required because, like I say, they're selling them for fish. Okay. So you're going to take your pill. This is a 500 milligram Cipro. I like to use this little marble mortar and pestle. You can use whatever you want. I mean, whatever you want to do to crush your pill. Some people you can use these. These are things that people use to crush pills. You put it in there, start turning, and it'll crush it. Or you can use this. This is what I like to do. I like to bang it up first, and then I grind it into a powder. Okay, so I've got this thoroughly into a powder here, because you need it in a powder. Now this is really important here. Not all antibiotics are soluble in water. Cipro especially, Baytril, they are soluble at pH 4. Water is pH 7, so it's not going to be soluble. I liked this little picture here because it's the difference between a solution and a suspension. The solution, if I put salt or sugar in water, it's going to go into solution and you have a solution. If I put sand in water, it's never going into solution. It'll settle right down to the bottom. Okay, that's what happens to Cipro and Baytril. They are not soluble at pH 7. So basically, what you need to do is you're making a suspension, so you need to keep those particles suspended. So you need to be rocking that stuff. You need to make sure you shake it up, otherwise your Cipro is going to be on the bottom of your vessel. So you have to shake it up really well. Now I came upon something that I think is going to help a lot of people that are rehabbers that do this. I thought, you know what, if pharmacists do this, why can't we do it? Why don't we use a suspending agent? And Dr. Emerson actually mentioned it last year in her talk. She uses it. The one she uses is called Flavor Plus. The reason I know is because I wrote it down. Okay, and I looked at that one, and I was actually going to buy that one, but there was a reason that I decided to use a different one. Tell you what, let me go ahead and talk about this, and then we'll go back. Okay, let's see. I'll come back to something. Okay, this is a suspending vehicle. This is what pharmacists use. Okay, not all pills come, or not all antibiotics come in a liquid form. Okay, what if you want to use it for a baby? They compound a pill. What if you want to use it for an old person that can't swallow anymore? They compound a pill. So basically what they're doing is they're doing exactly what I'm doing right here. They're grinding that pill, but see, they're keeping in mind, you know, they're a little more sophisticated than we are. They're not going to be putting it in water. They're going to be putting it in something like this. This is called Aura Plus. This is the first one over there. This is a suspending vehicle. It's a little bit thick, not like syrup, but it's a little bit thick. It will suspend those particles. It's like a matrix that will suspend the particles and keep. Now clearly you do have to shake it, but not to the degree that you do in water. Okay? What I really like about this is that it has stabilizers. It prevents, it's slightly acidic, so it prevents the drug from deteriorating, degrading. In water, that's only good for 7 to 10 days. Then you need to throw it away and start over again. In this, I actually found a study, and it's in your handout there. They tested Cipro in this suspending vehicle. They tested it up to 56 days. It maintained 99% of its activity for 56 days. So in other words, you don't have to keep making your drugs over and over anymore. What I think a good rule of thumb, though, is, you know, because we don't know the long-term stability, I think it would be best to just keep it 30 days and then throw it away, use another pill. This is bought off of Amazon. It's a pint, 473 mLs. It was about $25. Okay. There's actually different formulas, and if I had been totally on board when I first started, I would have probably just bought one of these instead of 3. This is your suspending vehicle. It's not flavored. This is your sweetener. So you can add the two together, which is what these two are. That's your suspending vehicle, that's your sweetener. You can put them together. Say if you were going to use 20 mLs of water, this you use 10 and 10. These two right here are sugar-free. They have like an artificial sweetener. I don't like artificial sweeteners. And then I discovered what we really need, which is Aura Blend, which has the sweetener already added to the suspending vehicle. So now instead of using water, you can use this instead, and it's maintained the stability, and you can use it for a lot longer. And it's also sweet. Okay, now I'm going to tell you this. I did this the other day just to see how this would work before I got up here, made myself foolish. So I did a Cipro tablet just like this, and I added my Aura Blend to it. Let me tell you something. Cipro is bitter. Baytril is bitter. There's not enough sugar on this planet to make that taste good. Whoa, I put that to my tongue. Oh, it took me a long time to get that nasty taste out of my mouth. So even though it's got a sweetener, it's not going to help Cipro or Baytril because they are nasty. So anyway, but some of your other less nasty things like Clavomox, you know, sweeten it up. They'll probably take it readily. They'll be okay with it. But honey, you can't fix Cipro. Oh, here's an interesting fact. You know, that's the fluoroquinolone group. Do you know where that word quinolone comes from? Quinine. It's a derivative of quinine. Now, has anybody ever tasted tonic water? Ooh, that's nasty stuff. Nasty stuff. Well, and that's why, you know, these Cipro and Baytril, they're pretty nasty. And you can't can't fix them. They're nasty. Okay, so anyway, I'm going to go ahead and make a suspension with my Aura blend here. Okay, now I'm probably going to need my glasses here. Okay, I've already figured this out in advance, but I'll show you, because you want to make your solution such that you give a large enough volume, but you don't want it to be too large. You don't want it so diluted that you have to give a half a cc. Honey, you ain't getting a half a cc of Cipro or Baytril in a squirrel. Oh, there's no way. You're going to be lucky to get a drop into them, so you want it just about right so that your volume is minimal. Okay, so I've already prefigured this, so basically, and then every bit of this stuff was bought off of Amazon. I believe you can buy a nuclear reactor off of Amazon. I mean, really, with the exception of the Cipro, okay? Okay, so, and you can see it's a little bit thick. Okay, that's 20 mLs of your Aura blend. Okay, now, and I've got a slide, but I won't go back to it. But if I put 10 mLs of Aura blend or water in a 500 milligram pill, what would my milligram per ml be? Say I put 10 mLs. 50. Bang! He wins the prize. It's 50. All you do is divide the concentration of your pill by the volume of the fluid that you put in there. Okay, I just made a 500 milligram pill. I'm going to add 20 mLs of my Aura blend. So what would my concentration be? 25.
Okay, so it's concentration divided by
the volume. By volume. Okay. Okay. So now you have your solution. It's 25 milligrams per ml. Okay. Now this does take a little bit of effort to get into solution, and I probably won't spend enough time here to get this done because I know I've probably gone over my time. I'm absolutely certain I have, and I need to move. Okay. Yeah, it is. It takes a while to get it into solution.
So that's
25 milligrams per
so
ml.
now it's 25 milligrams.
Right. Okay. Now, if we go back to our formula, whoa. I want to, well, maybe I'll show it. Maybe I'll show it here before I go to the iPad, because I'm going to do it on the iPad. That's the blend. Okay. Now, these are the advantages of your spending reagent. I'm going to get back to the formula. And those are just some pages copied out of Here it is. This is your formula. All you need is 3 numbers. You need the weight of the animal in kilograms. You need the dosage from the Wild Mammal Baby book. And you also need the concentration of the drug. In this case, 25 milligrams per ml. Okay, so we're going to calculate that. Okay, let's see here. Bring up the trusty old iPad here. Okay, let's see here. All right, that's my flying squirrel Tucker. Okay, so we're going to bring up our calculator here. Okay, and we will get clear. So it is our weight. Okay, give me a weight. Somebody give me a weight of a squirrel. Oh, that's a big squirrel.
287 grams.
280. That's a big squirrel. That's a really big squirrel. I'd have to do some more math to get to that one, okay? So, what's that? I'm sorry.
3/4 of a pound.
3/4 of a pound. Can you give me one in grams? So
280 grams.
280 grams. There we go. 280 grams. See, the thing is, if you do it in pounds, you're going to have to convert it. So we'll do 280 grams. Okay, so 0.280, that's your weight in kilograms, times, this is Cipro, the dose is 10 milligrams per kilogram, times 10 equals 2.8 divided by the concentration, which was 25. Okay, for a 280 gram squirrel for Cipro, the volume would be 0.112. Now, that's because we put in those numbers. You can't dose that. By the way, I brought everybody that would like one a little dosing kit. It's a little bottle with a top, and it's got a dosing syringe. I don't like this syringe. It's a 1 ml. I actually brought 100 of these little tiny ones. These are 0.5 for dosing. So these come from Chris's Squirrels or More. So these are really good for drawing up small volumes. You can't measure that 0.112. 0.1 is close enough. You can't measure that with this. You know, you just can't. Okay, so that was our volume that we got there. Okay, so that would be the volume for a 280 gram squirrel. Okay, now we talked about if you have math anxiety, okay, and you don't want to do it by math, okay, there is an app called Vet Clipboard.
What?
Vet Clipboard. Vet Clipboard. It's on Apple devices. You can also get it for Android devices. Just FYI, if you don't have a smartphone, I got a semi-smart one, but not real smart. But anyway, if you want to be able to do that, and you don't have a smartphone, you can buy something like this. This is an Amazon Fire that I bought on Black Friday for $34. So it's really not that expensive. So you can load up apps on something like that. Okay, and you can see the second one there is a dosing calculator. Okay, so we go to our dosing calculator. Look at there, it's asking us for our 3 numbers. Now actually on this app, we could have done the pounds. You see that? Because it does give an option for pounds. Okay, but let's go to the kilograms. So what did we say, 280 grams? So that would be 0.280. Okay, the dose per kilogram was 10. And the concentration of our solution was 25. Okay, you hit calculate, bam, there's your answer. See there, you didn't even need math to do that.
Wow.
Isn't that easy? Very simple.
Now, what is the name of this app?
Vet Clipboard. Vet Clipboard. And it's in your handouts. You know, I skipped over a lot of my slides there at the end because it's, you know, it's getting tight.
They're awesome.
Okay, let me just, I'll have to go, we'll go to the end here, and let's see, we'll go back to my thing here. Okay, this. It took about $100 worth of adapters to be able to hook up an iPad and a laptop, and a projector and a laptop. So wait, okay, it'll take a second to think about that. Or maybe I didn't hit my button.
One more.
Oh. Okay, I must not be on the right one.
Computer one is where you want to go.
Oh, there it
Perfect.
is. There we go. Okay, it takes a second for it to register. Okay, we're going to skip by all these. The Wild Mammal Baby Book, you can either purchase it here at Chris's Squirrels or you can phone a friend and ask them, look it up for me, and they can give you the dose from that book.
It's only a decimal point. Is that what you were looking for?
Yeah. Oh, there it is right there.
That was
I have trouble with this thing, don't I? Okay, that's what the app looks like. That is the dosing calculator. That's what it looks like on your app. And it's a free app. Okay, that's what it looks like.
Patty, how do you get them to drink the shot glasses?
That's a good one.
That's next year.
That's next year, yeah, we'll talk about that next year. So that's it, that's all I got. I'm sorry, I kept you probably overtime, way overtime.
This is great.
Yeah, sure.
Suspension agent?
Yes.
How long does that last for, like storage? Because, you know, you have a
Oh.
couple of squirrels.
Actually, you know, I'm glad you asked that question because, you know, I'm into expiration dates. I looked at this, I bought this like a couple months ago. The expiration is 12/2018. So it's good for a pretty good time. So I thought, you know what, that's got a pretty good shelf life on it. So that's something I could keep around. So anyway, so I will go ahead and just dismiss everybody. Thank you for your attention. Everybody very, very seemed engaged, so I think everybody.
It's very valuable. Thank you.
Where are the rest of our people are at?